You may have seen this impassioned video floating around the internet as Melbourne, Australia headed into its fifth lockdown on Thursday, 15th of July 2021 by Victorian photographer QALY Söderström.
I'm going to put it all out as bare and raw as I possibly can so that whoever this reaches, maybe you will understand the implications of these lockdowns.
Melbourne has been the most locked down city in Australia, with its population now going through its fifth lockdown, totalling 178 days of lockdown, with its longest lockdown spanning a non-stop 112 days. Given there are 365 days in a year, that's almost half a year in lockdown since March 2020. As of Friday, 16th July 2021, 12 million people, or nearly half of Australia's population, were under stay-at-home orders in Australia's two largest cities, Sydney and Melbourne, with only 4 reasons to leave their homes: shopping for food or other essential goods and services, medical care or compassionate needs, exercise, and essential work or education where it's not possible to work or study from home. The focus of the media has been on COVID cases, hospital admissions and deaths, and vaccination rates. However, there is less discussion of the economics of lockdowns and whether they're an efficient tool for bringing COVID under control and maximising the well-being of society. Certainly, lockdowns are a relatively new feature in public health policy, as they quarantine not only sick people but also those who are healthy and cause extreme disruption to people's work, study and lives. In this video, we'll take a look at what are the economic arguments for and against lockdowns. Are they actually serving their purpose of saving lives and improving the lives of country's citizens, or do they in fact cause more harm than good? This video is brought to you by I Dream of Money, the channel bringing you videos about business, economics and money. Help us reach 1,000 subscribers by clicking on the like and subscribe buttons so you never miss out on a video. Professor Gigi Foster, a professor with the School of Economics at the University of New South Wales, made headlines in April 2020 when she appeared as a panellist on an ABC show, QandA, and questioned whether lockdowns were the most appropriate way of dealing with the pandemic, to much outrage. In making her case, she used the idea of quality adjusted life years, or QALYs, a widely used concept used by health economists to determine what is the most efficient and effective allocation of limited funds for healthcare. Under the QALY framework, one quality adjusted life year, or QALY, is equal to 1 year of life in perfect health. The theory is that allocating health resources to maximise the number of QALYs in society is the most efficient solution. In this cost-benefit analysis, tabled to the Victorian Parliament COVID-19 inquiry, Professor Foster argues that the minimum cost of a month's worth of wholesale lockdown is estimated at 110,495 QALYs related to reduced well-being relating to mental stress, reductions in economic activity directly attributable to government restrictions, increased suicides during lockdowns, and foregone wages of children suffering disrupted schooling during lockdowns. Meanwhile, the estimated benefit of locking down forever, not only per month, to prevent COVID is only 50,000 QALYs. Professor Foster therefore concludes that just 1 month of lockdown is more than double the cost in terms of quality of life of the benefit of avoiding widespread COVID. In fact, developed countries use the QALY framework to make decisions about which medicines to buy or treatments to subsidise. One QALY is typically valued at about $100,000, though in Britain that figure is about £30,000. Therefore, according to Professor Foster's estimates, the benefit of COVID is to save 50,000 years of healthy life, which is worth $5 billion. However, the minimum cost of 1 month of lockdown is $11 billion. Professor Foster also notes that this calculation doesn't take into account the long-term effects of lockdowns, including the cost of increased non-lethal self-harm during lockdowns, increased domestic violence during lockdowns, reduced worker productivity during lockdowns, crowded out healthcare during lockdowns, for example, missed cancer screenings, stroke treatments, or surgeries resulting in deaths and suffering of non-COVID cases. However, many economists disagreed with Professor Foster's analysis, with 265 Australian economists signing an open letter to the Prime Minister and the National Cabinet in April 2020 supporting social distancing and lockdown measures. They argued that it would not be possible to have a functioning economy unless the health crisis is addressed first, and that strong fiscal measures are a much better way to offset the economic costs of lockdowns than prematurely loosening restrictions. The Ethics Centre, an independent not-for-profit organisation which provides a forum for the promotion and exploration of ethics and ethical decision-making, also questioned whether it was ethical to rely on the QALY framework to make decisions in the pandemic. In this article published in May 2020, The Ethics Centre noted that using the QALY framework was adopting a policy of utilitarianism, which is maximising the benefit of people in society that reduces the value of human beings to a unit of calculation. This violates the ethical precept that every human being possesses an intrinsic dignity. They also argue that there was a fundamental asymmetry between the risk posed to life by COVID-19 and the risks posed by the lockdown. They noted that there was no cure, no vaccine, and there was no way to know how the disease would progress. Meanwhile, there are a significant number of options for preventing or minimising the harms caused by lockdown, such as investing in mental health treatment and providing financial support. So who's right? If we go back to the viral video of Ms. Söderström, she raises the issue that someone in her situation who is living in regional Victoria, who runs her own business and who is single, has fallen through the cracks and has not received any government support. This is contrary to what the economists who supported government restrictions recommended. Meanwhile, many of the views expressed by economists at the start of the lockdowns were based on insufficient information on how COVID-19 would progress. With the world now more than 18 months into the pandemic and learning more and more about how to tackle the virus, it begs the question as to whether government approaches to the pandemic should also change. Also, no one at the start of the pandemic thought restrictions would last as long as they did. If people had known, would their views have changed? Also, as I have stated in previous videos, governments are printing money at unprecedented rates to provide support to people impacted by restrictions. With inflation now creeping up around the world, there are real concerns that the flow-on impacts of restrictions and government support could include societal breakdown and lack of basic goods, like food and healthcare, as seen in countries experiencing hyperinflation. Will there be unintended consequences of lockdowns which far exceed what any economist could have imagined? So I ask you, did lockdowns cause more harm than good economically? Let me know in the comments below what you think. If you like this video, please remember to like and subscribe to this channel. Thanks for watching, and until next time.